The real difference between type 1 and 2 diabetes. What doctors don't always tell you. Your doctor just told you that you might have type 1 or type 2 diabetes, and now you're confused, anxious, maybe even scared. What's the difference? What does that even mean for your future? You've probably watched a few videos already, and most just talk in circles without giving real answers. Well, this one's different. In just 6 focused minutes, you're going to understand the exact difference between type 1 and type 2 diabetes. From what causes them, to the symptoms, the treatments, and most importantly, how to know which one you might actually have. No fluff, no guesswork, just truth, clarity, and what you need to know right now. Because when it comes to diabetes, misunderstanding could cost you your life. And by the end, you'll know exactly what steps you need to take next before it's too late. 1. Root causes. Let's start at the root, because to truly understand diabetes, you must first understand why it happens. Type 1 diabetes strikes like lightning. It's an autoimmune disease where your own immune system, for reasons we still don't fully understand, suddenly attacks and destroys the insulin-producing cells in your pancreas. It often appears in children, teenagers, and young adults, sometimes overnight, without warning, and when it hits hard. Rapid weight loss, extreme thirst, constant fatigue, you can't ignore it. Type 2 diabetes, however, is a slower, more silent enemy. It builds up over years, often unnoticed. Here your body still makes insulin, but your cells become resistant to it. It's linked to lifestyle, weight gain, inactivity, poor diet, genetics. And while it tends to affect adults over 40, more and more young people are being diagnosed every day, fueled by the modern epidemic of processed foods and sedentary living. According to the Mayo Clinic, type 1 diabetes accounts for just 5 to 10% of all cases. The overwhelming majority, 90 to 95%, is type 2, a number that's only growing as our world becomes less active and more overstressed. So think about it. One attacks from within, almost instantly. The other creeps in silently, until it's almost too late to notice. But how can you tell which one you, or someone you love, might have? Because if you wait until diabetes makes itself obvious, you may already be living with dangerous damage inside your body without even realizing it. Next, I'll show you exactly what symptoms to look out for, the warning signs your body is screaming out, and how ignoring them could cost you more than you ever imagined. 2. Recognizing symptoms. So, what are the warning signs you should be watching for? For both type 1 and type 2 diabetes, some symptoms overlap, but the intensity and the timeline are completely different. In type 1 diabetes, symptoms tend to strike suddenly and forcefully. Imagine feeling an overwhelming, unquenchable thirst, no matter how much you drink. Imagine running to the bathroom over and over again, day and night, because your body is trying desperately to flush out excess sugar. And most alarming, imagine losing weight rapidly, without trying, pounds just disappearing off your body in a matter of weeks. This kind of fast, dramatic shift is typical of type 1, and it's often what sends people racing to the doctor. Type 2 diabetes, however, plays a slower, quieter game. The thirst might still be there, the fatigue too, but it creeps up on you so gradually that it becomes easy to dismiss. You might just feel a little more tired than usual. A bit slower. Maybe you brush it off as getting older, working too much, or not sleeping well. And because there's usually no rapid weight loss, and the symptoms feel so normal, many people don't even realize they have type 2 until years later sometimes, not until irreversible damage has already been done. That's why type 1 often gets diagnosed quickly, because the body is practically screaming for help, while type 2 can quietly destroy your health from the inside out before you even know it's happening. And here's the part that most people tragically miss. The earlier you recognize these symptoms and act, the more choices you have, the more control you keep over your future. Because once diabetes has progressed, once the damage to your nerves, your eyes, your kidneys has started, no medication, no diet, no amount of regret can undo it completely. In the next few minutes, I'll show you exactly why early diagnosis changes everything and what treatment paths look like depending on your type. Stick with me, because the choices you make today could be the ones that save your life tomorrow. 3. Treatment options. Now that you understand the causes, here's where the real difference hits home. How each type of diabetes must be treated. If you have type 1 diabetes, insulin is not optional. It is essential every single day for the rest of your life. Your body no longer produces the insulin you need to survive, and without insulin therapy, your blood sugar levels would spiral out of control, leading to life-threatening complications within days or weeks. But type 2 diabetes tells a different story. In many cases, insulin injections are not immediately necessary. Instead, treatment often begins with lifestyle changes, improving your diet, increasing physical activity, losing even a small amount of weight. If that's not enough, doctors may prescribe oral medications that help your body use insulin more effectively. And here's the part that gives hope. According to the CDC, if caught early enough, type 2 diabetes can sometimes be pushed into remission. By losing weight, changing your diet, and moving your body, it's possible to bring blood sugar levels back to normal ranges without the need for lifelong medication. So in a way, with type 2, the earlier you act, the more power you still hold in your hands. But here's the truth no one likes to talk about. No matter which type you have, if diabetes isn't managed properly, the consequences are devastating. Blindness, kidney failure, heart attacks, amputations, a slow, silent loss of the life you used to know. In the next few minutes, I'll walk you through the real-world complications you need to know what happens inside your body when blood sugar quietly destroys your most vital systems, and most importantly, how to protect yourself before the damage is irreversible. 4. The hidden dangers. Now, let's be absolutely clear. Both type 1 and type 2 diabetes can be devastating if not properly controlled. There is no milder version, no safer option. They are different diseases, but their consequences are frighteningly similar and equally deadly. If blood sugar remains uncontrolled, both types can silently attack your body from the inside out. Over time, the tiny blood vessels in your eyes can be damaged beyond repair, leading to blurred vision or even complete blindness. Your kidneys, those silent workers filtering your blood day and night, can become scarred, weakened, until they fail entirely, forcing you onto dialysis just to stay alive. And your heart? Diabetes dramatically increases the risk of heart attacks and strokes, often without warning. Even your nerves aren't safe. As damage builds up, you might start losing feeling in your feet and hands. A small cut or blister that goes unnoticed can quickly turn into a life-threatening infection, leading to amputations that steal more than just your mobility. They steal your independence, your confidence, your very sense of self. And once this kind of damage is done, once it's written into your body, it can never be completely erased. But here's the heartbreaking part. Most of these horrors don't happen overnight. They build slowly, silently, over months, even years, while you feel almost normal. That's why early detection and proactive management are everything, because right now, your body may already be warning you. You just haven't learned how to listen yet. In the next few minutes, I'll show you how doctors truly tell the difference between type 1 and type 2 diabetes, what tests matter, and what results could change the course of your entire life. Don't guess. Don't wait until it's too late. Let's move into the most critical step: how to know for sure. 5. Diagnosing your type. So, after everything we've talked about, how can you know for sure which type of diabetes you're dealing with? The answer isn't guessing based on age. It isn't guessing based on symptoms, and it definitely isn't hoping for the best. Blood tests are the key. According to the American Diabetes Association, there are a few critical markers that doctors rely on to distinguish between type 1 and type 2. First, they measure your C-peptide levels, a substance your pancreas releases along with insulin. If your C-peptide is low, it means your body isn't making much insulin at all. A red flag for type 1. Next, they look for autoantibodies, your immune system's fingerprints on the crime scene. If you test positive for markers like GD or IA2 antibodies, it's a strong indication that your own immune system has attacked your pancreas, pointing toward type 1 diabetes. Finally, doctors observe how your body responds to treatment. If simple lifestyle changes and oral medications don't seem to work, and your blood sugar remains stubbornly high, it may be a sign that insulin therapy is urgently needed. This isn't about assumptions. This is about using science to know your enemy and choosing the right weapons to fight it. Take Emily's story, for example. She was 32 years old, slim, active, seemingly healthy. She thought her constant fatigue, relentless thirst, and sudden 5-kilogram weight loss were just stress or overwork. But when she finally got tested, the truth hit hard. She wasn't dealing with prediabetes or a mild blood sugar problem. She had full-blown type 1 diabetes, despite being far past childhood. Without those blood tests, her diagnosis would have been delayed, and the consequences could have been deadly. So don't guess. Don't gamble. If you're experiencing symptoms, or even just have risk factors, get tested. It's the only way to move forward with certainty and protect your future. Because here's the brutal reality. Every day you wait without knowing, every day you assume it's nothing serious, is a day that silent damage could be happening inside your body. Knowledge is power. Action is survival. And now that you understand the difference between type 1 and type 2 diabetes, in the next few minutes, I'm going to show you exactly what steps you need to take starting today to reclaim control, protect your health, and live stronger, no matter which diagnosis you face. 6. Bonus common questions. Before we close, let's answer the two biggest questions almost everyone has when they first hear about type 1 and type 2 diabetes. First, can type 1 turn into type 2? The answer is simple. No. Type 1 and type 2 are fundamentally different diseases. Type 1 is an autoimmune condition. Type 2 is a metabolic disorder caused by insulin resistance. They don't morph into each other, although over time, both can require insulin to manage blood sugar. Second, can type 2 diabetes be prevented? The good news, yes, it often can. According to the CDC, by maintaining a healthy weight, staying physically active, and reducing your intake of refined carbs and sugars, you can lower your risk of developing type 2 diabetes by up to 58%. Small, consistent choices today can make the difference between a lifetime of struggle and a lifetime of strength. 7. Conclusion. Now you know the real difference between type 1 and type 2 diabetes, from their root causes to their symptoms, treatments, and lifelong impacts. And more importantly, you understand why early action matters so much. If you found this video helpful, don't forget to hit that subscribe button because we've got many more practical, research-backed videos coming designed to empower you with real knowledge you can use to protect your health and your future. And if you're wondering which type you might have, or if you just want to share your story, drop a comment below. I personally read every message, and I'll do my best to reply with thoughtful, detailed answers to help guide you on your journey. Remember, your health isn't something you should have to guess about. It's something you have the power to understand and to take control of, starting today.